You can go ahead there now, Dr. Fitzgerald.
Thank you. Thank you all for joining us today. Since the last update yesterday, we have 480 new confirmed cases of COVID-19 in the province. 209 are in Eastern Health and 81 are in Central Health. 99 are in Western Health and 85 are in Labrador Grenfell Health. 6 are awaiting region confirmation. There have been 168 new recoveries, leaving 4,370 active cases in the province. Our total provincial case count is 7,537. 3,835 tests were completed since yesterday, with just under 420,000 tests completed to date. 4 people are hospitalized as a result of COVID-19. We are also very sad to report another death in the central region due to COVID-19. Our thoughts are with the loved ones of this individual today. This is the 21st death in the province due to COVID-19. With over 4,000 active cases isolating in the province, we have thousands more that are isolating as close contacts. Many of these people are essential to critical services that we rely on, such as healthcare and emergency first response, and services are stretched thin right now, with so many employees impacted as a case or a contact of someone with COVID-19. We've looked closely at the evidence around Omicron, and we know it has a shorter incubation period and perhaps infectious period than the variants that have come before it. Evidence indicates that those that are fully vaccinated with 2 doses or more shed the virus for a shorter period of time than those not fully vaccinated. And we also know that Omicron generally presents as a mild illness in those who are fully vaccinated. So considering all of these factors, we're making changes to our testing and isolation guidance for COVID-19 effective midnight tonight. Anyone that is fully vaccinated and has COVID-19 must now isolate for 7 days from the onset of symptoms, as opposed to 10 days as it was previously. This applies to those that tested positive and those that are symptomatic and a close contact of a case. The new isolation timelines for close contacts that do not have symptoms and are fully vaccinated are as follows. Isolation for household contacts who cannot isolate away from the case is reduced from 10 days to 7 days from the day the individual's symptoms began, or when they had their swab done, if they don't have any symptoms. The contact should avoid high-risk settings and do only essential activities for an additional seven days. Isolation for household contacts who can isolate away from a case, as well as those that are contacts outside of the household, is reduced from 7 days to 5 days from the last date of exposure. And they should avoid high-risk settings and do only essential activities for an additional 9 days. The new isolation timelines for close contacts who do not have symptoms and are not fully vaccinated are as follows. Isolation for household contacts that cannot isolate away from the case is reduced from 24 to 10 days from the day the individual's symptoms began, or when they had their swab done if they don't have any symptoms. These contacts should avoid high-risk settings and do only essential activities for an additional 4 days. So to be clear, the 24 days in this circumstance accounted for the 10 days of isolation with the case until the person was recovered, and then an additional 14 days after recovery for the contact. Isolation for household contacts who can isolate away from the case, as well as contacts outside the household, is reduced from 14 days to 10 days after the last date of exposure. Again, these contacts should avoid high-risk settings and do only essential activities for an additional 4 days. We are also making some changes to testing protocols to ease some of the strain on public health resources. So anyone that has a positive result on a rapid test, including travelers, should consider that confirmation that they have COVID-19 infection. They will not need a PCR test to confirm. They will need to follow the self-isolation requirements for a positive case as well as the notification of contacts. There are exceptions to this. You should still book a PCR test if you work in healthcare, as a first responder, with the Coast Guard, in a correctional facility, if you work in or attend a daycare, emergency shelter, transition house, or other housing program serving vulnerable populations, or you live in a long-term care facility, personal care home, community care home, or assisted living facility. Anyone that has symptoms and has not had a known exposure to COVID-19 should still book a PCR test, even if they tested for negative on a rapid test. So while a positive result on a rapid test is reliable, a single negative result is not as reliable. Anyone that tests positive on a PCR test can view that result on the Public Health Testing Results portal. The portal will link them to all the instructions that an individual needs regarding their isolation requirements and notifying their close contacts. They should not expect a call from public health officials given the number of cases we are seeing. The information contained on the website is the most up-to-date and is considered public health direction. Effective midnight tonight, anyone that is currently in isolation as a case or close contact can start to follow these new isolation timelines. So I know that there are many details in the information I just provided, and we will be posting this information on our website so that individuals can see how this pertains to their own circumstances. The situation continues to evolve rapidly, and we cannot rule out additional changes in the coming days or weeks. We ask that everyone that may be impacted as a case or a contact to pay close attention to updates from public health to find out the most current guidance. We have always had a careful balance to achieve controlling the spread of COVID while minimizing impacts to the health and well-being of the population. And that balance has never been more delicate than it is now. These are not easy decisions, and every change has a reverberating impact somewhere for someone. So we need to ensure that we have essential workers to provide essential services. We need to have care for the children of essential workers. We need to focus on protecting those most vulnerable, and we need to have healthcare staff available when people need care. This is a difficult time for everyone, and now more than ever, our province needs patience and kindness while we get through the most challenging wave of COVID-19 yet. We will get through it, and we will do it together, make no mistake. Hold fast, Newfoundland and Labrador. Thank you. And I'll turn it over to you, Nancy, for questions.
Thank you, Dr. Fitzgerald. Today we have 5 reporters joining us. We will have one round of the question and answer session, which will be 1 question and 1 follow-up per reporter. Our first questions are from Peter Cowan with the CBC. Peter, please go ahead.
Dr. Fitzgerald, how much was today's decision influenced by the pressures that we're seeing on the healthcare system with so many people isolating either because they have COVID or they were exposed and are isolating for that reason?
Certainly it played a role in us making that decision. We know that, we certainly, I mean, if we didn't have that evolving or an emerging evidence to suggest that we could do this, obviously safely, then we would have to find another way. But we certainly look to that science as well, of course. But, there's no doubt that this had a major impact on the provision of essential services. And we do have to keep that in mind as well and take that into consideration when we're making these kinds of decisions. So as everywhere else has had to. So it did play a role for sure.
The federal health minister said today that he thinks provinces are going to have to go down the road of making vaccinations mandatory. He stressed that that was his personal view rather than official government policy. I wanted to get your take on that idea that the only way we're going to get out of this is if we force, in this province, the last sort of 7.5% to get vaccinated.
I really wouldn't want to respond to that on the fly. That is a huge question that has a lot of repercussions. So, but certainly here we do have an excellent vaccination rate for 2 doses, and we should be very proud of that. I think now more than ever, it's important to get that third dose, get your booster, so that you can make sure that your protection is as good as it can be against Omicron. And we know that people who have a booster dose seem to do much better with regard to severe symptoms. So that is very important. But those are bigger questions, and I don't know that I'm really prepared to answer that today.
Our next questions are from Brian Callahan with VOCM. Brian, please go ahead.
Thanks. Can we go back over the rapid test and PCR test information again, Dr. Fitzgerald? I just want to be clear. So if you get a positive test from the rapid test, you should go get, or you should assume that you are COVID-19 positive. But if it's negative, you should assume nothing and go and get a PCR test.
Right. So, okay, if you do not have symptoms and you have all negative tests on rapid testing, like say if you're a traveler who came in and you got your 5 rapid tests and you had all negative tests and you don't have any symptoms, you're free to go. But we're doing those negative tests on what we call a serial basis, right? One after the another. And so a negative result is much more reliable when you have repeated tests. But for somebody who has a rapid test for whatever reason, whether they've gotten it, through their work or through another means, if they're just doing it because they have symptoms and they want to find out if they have COVID or not, you can't assume from a single negative rapid antigen test that it's not COVID, because there can be somewhat of a delay in the rapid test turning positive after you develop COVID. And so that's why we do those extra tests in a row, on consecutive days to sort of overcome that drawback to the test. However, we do know that if you have a positive test, and especially if you have an exposure risk, so if you have been somewhere where there's a high prevalence of COVID, or you are contact of somebody who has COVID and you have a positive test, we feel much more comfortable that that is indeed a true positive. The test just behaves better in that regard. And certainly if you have symptoms and you have a positive rapid antigen test, in our prevalence situation right now, you should assume that that is a true positive test. But if you have symptoms and a negative test, again, because it's just one test at one time, and there can be that little bit of lag, you should not assume that it is truly negative. And that's why we recommend it for symptomatic people who have a negative test, that they still get the PCR. Does that make sense?
Yes, absolutely. I follow. It's a lot of information, as you said, off the top. So I just wanted a little bit of clarification, maybe. So, and follow up with regard to the Vax Pass and the booster shot, where are the discussions in health with regard to that? Like, at what point do you look at the Vax Pass and the booster becomes mandatory?
So certainly those are questions that everybody is looking at and everybody's asking at this point, but I don't know that anybody's really landed on those, the answers to that just yet. So I guess those questions will, those discussions will have to be going on in the coming weeks, I guess, as we see better how the booster is performing and just what the effects on severe disease are.
Thanks.
Our next questions are from Ben Cleary with NTV. Ben, please go ahead.
Good afternoon, Dr. Fitzgerald. My first question is that the PC Party says the Canadian military should be called into Labrador to help distribute vaccines. Do you think that's necessary right now?
Well, I mean, those are not, those are bigger questions than just me to answer. And certainly if Labrador, that there has been support provided to the region for vaccinations, and we're in conversations with the regional health authorities to help them be able to deliver vaccines effectively. So I guess, at this point, I'd have to defer to the bigger conversation, really, than my own opinion.
Thank you. And the biggest reduction in isolation requirements now was for unvaccinated households who cannot isolate away from a positive case. That was reduced from 24 to 10 days. Why was there such a large reduction possible there?
So the biggest reason for that was just for what we're seeing with regard to Omicron and how it's behaving. So we know that people are getting the disease. The incubation period is much shorter, and most people are becoming symptomatic within 2 to 3 days. And so we feel that, with exposures, by the time 10 days rolls around, that person, if they're going to spread it to someone in their household, they've already done it. And that person would likely become symptomatic in that time. So we've spaced out the testing to hopefully capture those people who will convert positive. But what we're seeing with this variant is that it's spreading so quickly, and the second generation of spread is happening so quickly that we can condense that timeline down.
Thank you.
Our next questions are from Ronelle Legros with All Newfoundland Labrador. Ronelle, please go ahead.
Dr. Fitzgerald, have we gotten to the point where asymptomatic healthcare workers who have tested positive for COVID might be called on for help regardless of their positive results? And if not, do you think?
Oh, sorry, Ronelle, we've lost you.
Okay, I'm not really sure how much of that you caught, so I'm just going to start. I'm just wondering if we've gotten to the point where asymptomatic healthcare workers who might have tested positive for COVID might be called on for help regardless of their positive results. And if not, do you think it might be coming to that?
So we are not generally there yet. I can't speak to, very specific circumstances. That may be a one-off situation that has to be dealt with, but certainly as an overall policy, we have not gotten there. I would not say that we won't get there. I mean, certainly we've seen in other provinces that they have gotten there. So, we may be in the same boat at some point. It is something that we will have to consider at that time, and obviously develop policies for how that can happen safely in those exceptional circumstances when it may need to happen.
And maybe if you could just tell me a bit more about the impact that this is having on the health system as a whole. We know services have been reduced, but at this point, I guess even keeping up with reduced services must be becoming a bit of a challenge.
So, I mean, obviously, my focus is public health, and I don't speak for the broader, health system, but certainly we know that there are a lot of health system employees right now that are isolating, either because they're a case or because they're a contact, and that certainly is having an impact. There's had to be, reduction in services to either make room or to prepare for potential COVID admissions, or looking at trying to increase vaccinations as well. So, redeployment of people from one area to another, that's had to happen. And so certainly we are seeing impacts in the health system. I don't, at this point, some areas are certainly more impacted than others, and we're keeping a very close eye on it. But I'm probably not the best person really to be speaking about that broader context.
Our next questions are from Andrew Waterman with The Telegram. Please go ahead, Andrew.
Good afternoon. So I've heard from some early childhood educators who are wondering why daycares and preschools are open, but schools are closed, considering children under 5 can't get vaccinated. And of course, even people in the healthcare system would have kids who are in school as well. So I'm just wondering what went into the decision to keep daycares open, but not schools open.
So there's a few things that go into any decision we make. And in addition to the risk to the individuals in the setting, there's also the risk to the overall setting with regard to outbreaks. And certainly with schools, we're seeing in larger populations that, there's more children, more staff coming together, and a higher risk for a larger outbreak that can result in a lot more people being infected. So that's a big reason why we were looking at schools at this point, just for the sheer amount of spread that can happen in one school. for example, right? We recognize that, there's no decision that we make that's going to be perfect in these situations. We try to make the best ones we can that allow for a reduction in risk as while allowing society to function as best as possible. So we recognize that this is one of those decisions that is not perfect. But we certainly know that daycare workers or childcare workers are a large essential service, and certainly we are. We're really, as a society, in their debt for what they have done throughout this pandemic and really come to work and showed up and done what they have done to allow our society to continue to function. But it is the difference is really looking at the overall situation and the potential impacts with regard to spread.
Thank you. I noticed earlier this week that Ottawa's Chief Medical Officer of Health, Dr. Vera Etches, actually released a statement saying that being in school is what's best for children, youth, families, and the health of the community overall. And that given all the evidence that she has seen and through talking to her colleagues, that spread within a school is still less likely than in the community. And she was actually calling on the provincial government in Ontario to continue or to open schools. Why do you think that she came to such? I know you don't, you can't speak for her, but why are we thinking so differently here, considering our cases are lower?
So I think, there's a lot of things that go into those decisions, and our capacity is one thing, and so I really, this is difficult because I really can't speak for someone else. I don't know the quote that you're talking about, and so I haven't read it in its entirety. So it's really not fair for me to make a comment on it. But we've made a decision right now that we feel is the best for us. And, we want kids to get back to school as quickly as possible. And we are putting some measures in place to give us some extra layers of protection for testing so that we can have kids go back to school and stay in school as much as possible. This Omicron wave hit us, right as the Christmas break was happening. And so it has taken us some time to get things organized. And I think it's important for us to make sure that when children do go back to school, that we can have them go back to school and stay in school for as long as possible and not have to be closing schools down so that, to control outbreaks and that sort of thing. So, we're trying to reach a balance here.
Thank you.
Thank you, everyone. Dr. Fitzgerald, do you have any final comments for today?
Thanks, Nancy. I just, want to encourage everybody, first of all, to get your booster dose or your first or second dose if you haven't gotten that of the vaccine yet. But certainly if you have and you're eligible for your booster dose, please make an appointment to get your booster dose. And if you aren't able to get an appointment, or you may not be able to get to your regional health authority clinic, check with your pharmacist or your physician. There's certainly more vaccine available there as well, and appointments available in different pharmacies and physicians' offices. Please stay safe, keep your contacts low, and make sure you wear your mask when you're out in public places, and take care.
Thank you. Thank you, everyone, for joining us today. Please stay safe.